digital health. With me, Murray Ellender, primary care doctor, CEO, co-founder of eConsult, a digital and remote consultation platform. Tough times though at the moment. Some of the players out there not finding it easy. They've grown big. You're in 50% of GP surgeries. What about those cost pressures? How's that affecting you?
Yeah, it's a very good point. I think the system is in a bit of a state of flux at the moment because we've got the competing forces of healthcare crisis and the need to do more. This workforce is never coming. The 6,000 GPs we keep waiting for, demand is going up. So there's definitely a need for technology and tools to support healthcare at the moment versus the kind of slightly burst bubble, which started, I think, in the US of technology. The bubble slightly burst. And I think you are seeing technology companies kind of scaling back and contracting, having to manage costs more carefully. My view on this is, look, I think there's always room for innovation and technology in healthcare. And I think the best businesses will get through this. And there's plenty of transformation that needs to be doing. When you look at how other industries have embraced technology, healthcare's yet to follow. So I still describe us as being in the foothills of digital transformation. There's lots of room for growth. It'll always be a bit ups and downs and slow down a bit, speed up, but there's no doubt there's room for growth in good businesses. And clearly I count eConsult as one of those successful businesses.
And as the sirens for the local hospital go off in the background here, you're moving into hospital care, to A&E now. So how does that work? Is that where innovation is? Because you're on the edge again.
Yes, it is. I think general practice, I'm clearly biased coming from a GP background. I still practice as a GP. And general practice has always been a bit more nimble and moved a bit faster in terms of adopting technology. I think the opportunity to transform hospitals is huge. And actually that's where a lot of the NHS budget is spent. So brutally about 10% of the budget is spent in general practice. We've penetrated that market really well, up to about 40% market share, as you said. But now actually there's a great opportunity in hospital to take the idea of what we do, which is gather the history from the patient, put it in front of the right doctor, and do that in a hospital setting. So the first place we're doing that is A&E. And the journey into A&E, which I'm sure you're familiar with, isn't great as a patient experience. You walk in, there's often a long queue for reception. You speak to a receptionist, tell them your story, and you go to wait to see a triage nurse, tell them your story, and then you have to wait a very long time to see a clinician, a doctor or a nurse. We've digitized that journey. So now when you walk into the A&E, actually you walk up to an iPad. There's never a queue because we put lots of iPads in. And as a patient, the iPad will ask you who you are and why you're there and gather that story from you in the patient's time. The patient then only has to enter that story once because it's then captured and put into the system. And you can then, based on that story, prioritize patients. You can say, well, actually, this patient's got chest pain, they're very sick, see them first, versus this patient can wait a bit longer to be seen. So it's digitizing that A&E journey. And we're now also doing a similar thing in outpatients when you go and see a specialist, digitizing that journey. So it's adding that kind of triage in to the front of every healthcare journey. So actually, you're empowering patients to tell their story and tell it only once. And you're also giving clinicians the opportunity to then prioritize patients based on need, because they know up front, well, actually, I need to see that patient first, or perhaps that patient's more suitable to go into a pathway somewhere else. So.
And it's interesting you say you think we're still in the foothills of digital health. The government's come out in the UK with a new strategy, digital health strategy. What do you make of it? Is it on track?
I think it's great that the government is doing this and talking about digital as a means to help solve some of the healthcare problems that we have today, because it is. So I think the fact that they've got a strategy tool is an excellent thing. Clearly, they're also looking at how data might spawn. There's a data strategy now and how we might use data better. And very carefully with patient consent, use patient data to drive better systems and better care for patients. So I think I am a fan. I think that what the system needs to do, though, is it needs to start thinking more as a system and less in silos. So the new integrated care systems, 44 of them in England, very similar to the health boards in Scotland and Wales, they all have a responsibility across GP and A&E and specialist care. So and social care, in fact, a responsibility for a whole system. Now, as long as they are starting to think about digital solutions that work across a whole system, that's great. Because at the moment, we're still in a world today where technology is being bought in silos. So we're buying systems for GP surgeries and systems for A&E and systems for... The problem there is you end up with a very complicated digital ecosystem. So I'm optimistic that the future is, integrated care systems will be thinking about, okay, well, in Northwest London, in Devon, how can we actually have a digital ecosystem that links patients throughout that journey? So yeah, I'm positive.
Well, we'll watch this space. Thank you very much for your contribution. Thank you.
Thank you very much.